First one, Director of Communicable Disease Prevention and Control, Dr.
Recording in
Imran.
progress.
And then the second, Doreen L. Robinson, Head of Biodiversity and Land Ecosystem Division, UNEP, joined virtually. And the third, Dr. Jean Phillips, Deputy Director General, Institutional Affairs and Regional Action, WOW. And then Francesco Branca, Director Nutrition and Food Safety, WHO Headquarter, joined virtual. And then the last one, Pete Sumption, Chief Veterinary Officer, Animal Production and Health Division, FAO, joined virtually. So we will start our press conference about the One Health. For the first one, I will give the floor for the Mr. Imran. The floor is yours. Okay, each speaker gets only 5 minutes to present about the One Health. Thank you.
Yeah, thank you, Dr. Ajir. Ladies and gentlemen, the COVID-19 pandemic provides a stark wake-up call to the world with far-reaching impacts on the economic and social life. The pandemic cannot be addressed effectively without cross-sector cooperation, coordination, and communication between and within countries, particularly through the One Health approach. One Health is an integrated, unifying approach that aims to sustainably balance and optimize the health of people, animals, and ecosystem. It recognizes the health of human, domestic, and wild animals, plants, and the wider environment, including ecosystems, and are closely linked and independent. The One Health approach mobilizes multiple sectors, disciplines, and communities at varying level of society to work together to foster well-being and tackle threats to health and ecosystems, while addressing the collective need for clean water, energy and air, safe and nutritious food, taking action on climate change, and contributing to sustainable development. Taking stock of the lessons from the global response to the COVID-19, we considered that the G20 forum would be the most appropriate forum to devise the best way of tackling the current pandemic and future health crisis. This is why we decided to organize a side event on the One Health during the Indonesia G20 presidency. The side event was conducted back-to-back with the second health working group on 8 June 2022. There have been 2 main concrete deliverables achieved through the G20 One Health side event. First, a Lombok G20 One Health policy brief and gap analysis on the One Health implementation for zoonotic diseases. And these results have been consolidated through 3 pre-event meetings, G20 One Health set event, and a series of intensive discussion involving the national and international stakeholders. The gap analysis was based on the self-assessment questionnaire initiated and developed by Indonesia as the G20 presidency and was further analyzed by One Health initiative by WHO. So there also in Lombok G20 One Health policy brief, there are 7 steps to improve One Health implementation. First is raise awareness. Second is identify gaps and opportunity. Third, develop mechanism to support on overarching One Health governance and coordination framework. Develop science guided by quadripartite, a One Health joint plan of action as a blueprint for action. And the last, implement the One Health approach in all relevant policies to better prevent, predict, and detect, prepare for, and respond to health threats. So Ladies and gentlemen, we do hope that the Lombok One Health Policy Brief will be able to guide us through our collective effort in strengthening the global health architecture, which has become the central theme of our G20 presidency. And we will be the most grateful for your support and in our effort to make a better world for us to live. Thank you.
Okay, thank you, Mr. Imran. Now, the second speaker, I'd like to invite Dr. Jen Phillips, Deputy Director General, Institutional Affairs and Regional Action. The floor is yours, Doctor.
Thank you. I represent the World Organization for Animal Health, WOHA, which is member of the quadripartite, which was quoted by my colleague from Indonesia. The quadripartite is a platform which gathers 4 international organizations, which lead let's say the One Health guidance at international level. We have FAO, we have UNEP, we have WHO, and we have WOHA, the World Organization for Animal Health, which previous name was OIE, Office International des Épizooties, based in Paris. So what are we targeting with One Health? We are targeting the diseases which are transmissible from animals to humans. We call them zoonoses. And zoonoses represent 60% of human diseases. And the figure is 70% and above when we are talking of emerging infectious diseases. I could mention Ebola, coming from bats. I could mention zoonotic hypopathogenic influenza coming from birds. I could mention the Rift Valley fever, which is a vector-borne disease. I could mention rabies, which is transmitted by the bites of dogs, in particular stray dogs in developing countries. One Health is a principle which recognizes that the human health, the animal health, and the health of the environment are interconnected. And is the reason why One Health is a lot about working without any silos between the different sectors. Animal health must talk to human health. Environmental health must talk to human health and animal health. We must talk together. We must work together. It's a lot about what we call deserialization. Not easy to pronounce in English, but I have to pronounce every day this word. And it's the reason why the quadripartite work together to develop a One Health joint plan of action, which targets the period 2022-2026. I will let my colleagues from the quadripartite develop more this plan. But what I would like to add to what already said Dr. Imran Pambudi is that the G20 Indonesian presidency did really a lot to promote One Health. It started after the Italian presidency, who published a call to action for One Health, a Rome Declaration. And here we have a masterpiece to advocate for One Health, which is the Lombok One Health Policy Brief. So I really encourage you to read this policy brief. All is inside, including the reference to the One Health joint plan of action. And I just came back from the first part of the ministerial meeting, and I had the pleasure to make a statement to commend this initiative of the Indonesian presidency. As you said, colleague, One Health is a lot about governance. We have to put in place the governance, the political commitment, the means to have One Health, not only a nice principle, but something becoming a reality in the field. We need political willingness we need investment. We need long-term commitment and investment. And I think that with the succession of G20 presidency, I hope that India will do the same to promote One Health. We can really rely on the G20 mechanism to promote One Health, not only for G20 members, but at global level. Thank you.
Okay, thank you, Dr. Phillips. And the third speaker, we will hear about the One Health quadripartite from Doreen L. Robinson, Head of Biodiversity and Land Ecosystem Division, UNEP. The floor is yours, Doreen.
Thank you so much. Sorry I'm not there today with you in person. UNEP is the newest member of the quadripartite, as was said, and we're excited to strengthen the environment dimensions so that together we can achieve holistic health outcomes. As expected, I will speak about the environment dimensions. No species, including the human species, can be healthy on a sick planet. The environment provides us with clean water, clean air, the genetic material for medicines, the diverse micronutrient-rich food, and many other services needed for all species to maintain their health on this planet that we share. It's easy to forget that biodiversity underpins the life support systems essential to human existence and well-being. Climate change, as it shifts agroecological zones, as it drives the migration of species, and again, including the human species, as it changes rainfall, humidity, and temperature affecting pathogen spread, has the potential to fundamentally change the disease and health risk map of the planet. Rampant pollution exacerbates sickness and impedes our ability to prevent and recover from health emergencies. As new health threats emerge, in the form of epidemics and pandemics, for example, lives are put at risk, animal health is eroded, and economies can be decimated. We're all still living through these impacts from COVID. We know that the degradation of nature and all of its services is driving up health risks and costs. Transformative change is needed to recalibrate humanity's relationship with the environment so that we can all thrive and prosper. Transformation is needed in how we tackle disease emergence, spillover, and spread, which is what the G20 is trying to do. This will involve placing greater emphasis on prevention and preparedness without neglecting response. This means investing in measures that take stock of, analyze, and act on the complex economic, social, and environmental determinants of health. The quadripartite, with the G20 and all of our partners, are committed to supporting the scientific and evidence-based interventions that are needed to drive the health transformation we all need and to channel scientific inquiry towards positive change and better action. Together with the One Health approach, we can drive a more holistic and impactful approach to securing human, animal, and environmental health for lasting progress and prosperity for all. Thank you.
Thank you, Doreen. And the fourth speaker, we invite Francesca Branca, Director Nutrition and Food Safety from WHO headquarters. The floor is yours, Francesca.
Thank you very much. And again, congratulations for this initiative. My task is to tell you a little bit more about the Joint Plan of Action. The One Health Joint Plan of Action is intended to guide the four organizations to work jointly on One Health with the aim of supporting member states to use a One Health approach in their national policies and strengthen One Health capacities. The plan illustrates the scope of work of One Health and proposes a set of activities that the four organizations of the quadripartite can offer together to enable countries to advance and sustainably scale up One Health in managing health threats to humans, animals, plants, and the environment. It includes 6 interdependent action tracks. First, enhance One Health capacities to strengthen health systems. Second, reduce risks from emerging and re-emerging zoonotic epidemics and pandemics. Third, control and eliminate endemic zoonotic, neglected tropical and vector-borne diseases. Fourth, strengthen the assessment, management, and communication of food safety risks. Fifth, curb the silent pandemic of antimicrobial resistance, and sixth, integrate the environment in One Health. The One Health approach needs to be applied globally, nationally and locally, involving all relevant sectors and groups in society and linking all layers from high-level policies to activities on the ground, including community engagement. This includes fostering a common understanding of the One Health approach and promoting One Health governance at all levels, enabling countries to operationalize One Health at scale. The joint plan of action will be accompanied by an implementation framework that will build on countries' existing actions and identified gaps. The implementation framework aims to operationalize One Health approaches at global, regional, and country levels and provide guidance for different government sectors on policy, legislation, advocacy, financing, organizational development, implementation and sectoral integration, and data evidence and knowledge. The framework will also give practical advice to countries on how to develop One Health capacities. The implementation framework is currently being drafted by the quadripartite through an active engagement with national governments and with all relevant stakeholders. The strong political will expressed by this G20 this year already indicates a very sound start for the rollout and implementation of the One Health Joint Plan of Action. So thank you for that.
Thank you very much. Now the last speaker, we would like to invite Keith Sampson, Chief Veterinary Officer, Animal Production and Health Division, FAO. Keith, the floor is yours.
Thank you very much, and really a thanks again to the Indonesian presidency for all their work to ensure that the Lombok One Health brief and other discussions were taken forward, and that we've really, during this presidency, considered the role of One Health within the global health architecture. So what do we mean when it comes to actions on the ground and the costs of those to implement them and to ensure that the joint plan of action really is fulfilled through the actions at country level? Well, as previous speakers have said, we've had to really consider how One Health changes our view of health and health systems and health financing. We understand that countries spend between 1% and 3% of their health expenditure on prevention of major epizootic and epidemic diseases. Of that, One Health really hardly features at all. So we recognize that there is a huge gap, not simply in the financing of prevention measures, but financing of One Health. So we should now think of health financing as being One Health financing because of the connection between One Health, the essential nature of One Health in our system to be able to guarantee and support health in humans, animals, and our ecosystems. So that requires us to rethink the way that we finance and to consider the financing at national levels, as well as the gaps that exist at the moment. So we recognize over a longer term, we can expect that investment in prevention at country level will require new domestic levels of expenditure and investment in that side to be able to secure a better future. As we move towards it, we recognize that there are gaps in current expenditures and expenditure flows and investment flows from partners. So under the Joint Plan of Action, we're looking at how, working together, we can ensure that those investments can be made in the areas that will create the greatest return and the greatest impact. We will require the investments also private sector and civil society in the same areas to be considered. The gap for pandemic prevention, preparedness and response is given in previous work under the G20 as being around a 30 billion a year gap. And we would estimate an additional 11.5 billion a year is needed to add properly the One Health approach. That sounds a lot, but that's only about $1.50 per year for everyone on the planet. A small price to pay for the type of improved health outcome we'd expect. So while there is an under-investment in human health, there's a huge underinvestment in animal, plant, and environmental health that will enable us to be able to achieve the outcomes we desperately need. The quadripartite stands ready to support all countries based on their needs, working with them to provide them an integrated package of services from One Health assessment to policy, programming, and capacity development. Through launching the Joint Plan of Action and the G20 Lombok Policy Brief, our emphasis is placed on providing support to the low and middle income countries to do that. Through our combined quadripartite mandates, our presence at country level, our UN and other partners, we are committed to working through a coalition of actors to effect change. We believe the return on investment is very clear and positive in regard to One Health, and this way will provide us with shared health, food security, and climate sustainable development for all. Thank you.
Thank you very much, Kit. Now we will start the question and answer session. For our online participant, please type your question and into the chat, and I will read them out. And then for join offline, you will give the question. Please introduce yourself and what is the question. Is there any question, Paul?
Thank you.
Okay.
I will speak in Bahasa. Okay.
Yeah.
Oke, saya Andi Firdaus dari kantor Berita Antara. Saya ingin bertanya kepada narasumber yang memang berkenan untuk memberikan tanggapan. Pertama, bagaimana tantangan di berbagai negara dalam aspek distribusi logistik vaksin maupun serum yang berkaitan dengan kesehatan hewan. Tantangannya saat ini seperti apa untuk pemerataan distribusi tersebut. Dan yang kedua, saat ini negara mana di dunia yang bisa dijadikan sebagai percontohan ideal bagi pendekatan kesehatan terpadu. Dan yang terakhir, bagaimana kebijakan yang tepat untuk bisa diterapkan di suatu negara untuk menekan laju penyakit yang disebabkan oleh hewan maupun lingkungan, serta bagaimana cara paling sederhana yang bisa dilakukan oleh individu dalam menerapkan kesehatan terpadu. Terima kasih.
Bisa diulangin yang kedua, Mas, tadi?
Yang kedua, negara mana yang saat ini, negara di dunia secara global, yang bisa dijadikan sebagai percontohan dalam penerapan kesehatan terpadu yang ideal gitu. Mungkin negara tersebut bisa kita contoh metode pendekatan terhadap metode apa?
Metode One Health maksudnya.
One Health-nya, iya.
Okay. The first question, I think our colleague from FAO or HUHA can answer about the challenging distribution vaccine for animals, and then the second one, what's country that can be a good example for the One Health quadripartite? Jen?
I can start and give a first answer, and perhaps my colleagues could elaborate. Yes, vaccines are very useful tools to tackle diseases for which we have a vaccine. There are two diseases which were eliminated from Earth. One is a pox disease for humans, but another one, perhaps you don't know, is a rinderpest. It's an animal disease which is very dangerous for cattle. And our organization was created in 1924 because Europe was affected by this disease, and the countries wanted to join efforts to tackle the disease. And this disease has been eliminated thanks to massive vaccination campaigns more than 10 years ago. And we will celebrate very soon together with the colleagues of FAO this important event. But you are right to say that an efficient vaccine is not enough. You have to ensure a smooth delivery. Very often, you have to maintain the cold chain, which is a challenge in some countries. And you have to ensure that the vaccination act is really well done. And for this, in general, we implement a sero-surveillance campaign to monitor the efficiency of the vaccination. I will take one example, which is a One Health example. I already mentioned rabies. Rabies is really a very dangerous disease. If you don't intervene very soon after a bite by a contaminated animal, you are sure to die. But here again, we have a very efficient vaccine, which was discovered by Pasteur some years ago. This year is the 100th anniversary of the death of Pasteur. And we have collaborative efforts to deliver rabies vaccine. We have an international initiative, United Against Rabies. We have inside the World Organization for Animal Health, FAO. At our level, we manage a vaccine bank, which helps to deliver millions of vaccines. So it's very important to have appropriate efforts, not only to manufacture the vaccine, but I insist on the delivery, the cold chain, the serosurveillance, to monitor that it is very important. And it is efficient. And here again, I come to governance, because to have an efficient vaccination campaign, you have to strengthen the capacities of your health workforces. I say health workforces because for me, medical doctors, veterinarian have to work together to tackle this kind of disease. And strengthening the capacities of veterinary services, strengthening the capacities of human health services is really a key factor to have an efficient vaccination campaign towards zoonotic diseases. Thank you.
Chair, could I intervene?
Okay.
Thank you. Just to supplement what Jean-Philippe has said, for animal health, one of the issues is that most of the costs relating to vaccines need to be met by livestock owners. In few countries are the government services able to provide the costs of vaccination, which is something very different from human health. So that gives us particular challenges when it comes to zoonotic diseases, because they may not actually show many signs in animals, and therefore the livestock keepers may not wish to invest in them, and the vaccine producers may not also decide to invest in that market. So there is a potential risk there that is being looked at by the international community, and considering in the way that we have done with COVID-19, the need for advanced market commitments to be able to guarantee that there would be an uptake of vaccines should there be a need. So we do have particular issues and concerns that for the large number of newly discovered viruses that could be of risk, we don't have the vaccines at the moment. And therefore, it's super important that we spend time preventing those spillovers, but also containing them, because we will not have the vaccines in place, but we'll need to use other measures. In regard to countries with good examples of One Health platforms and programs, we can give you quite a number of those who've been established in the last few years. But countries like Senegal have a very promising and effective way of working together across the sectors. But there are others we could also give. Thank you.
Thank you. The second one about the country that can be example about the One Health.
Yes, I just mentioned one there. I don't want to single out individuals when there are other ones. We do work as a quadripartite at the regional level, but also supporting and promoting national One Health platforms. There are other countries in Africa, many also in the East Asian area. But around the world, in each region, there are champions of this approach. Thank you.
Okay, thank you. And is there any question?
Mr. Chair, can I add something on the countries?
Okay, okay.
Thank you. So now I just want to inform about a very interesting analysis that the quadripartite has done among the G20 countries. And we've asked all the countries to tell us where their investment had been in a series of One Health collaborative initiatives. And I must say that it's interesting to hear that there's been quite a lot of investment on antimicrobial resistance coordination mechanisms. They're common and perhaps a bit more in high-income countries than middle-income countries. But there are also some relatively good food control systems related to the food safety space. Less investment on zoonosis, but zoonosis